The Beaufort County Board of Commissioner meetings is now called to order. If you would, please join us in our invocation and our pledge. Vice Chair will lead us through our invocation, and Commissioner Porter will do our pledge.
Let us pray. Eternal God, our Father, we are grateful and thankful that you have allowed us to assemble here one more time. We ask you to order our steps and lead us and guide us by thy Holy Spirit, that we may make wise and prudent decisions for your people. In Jesus' name we pray. Amen.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Start off by, does any commissioner have any conflict of interest that they'd like to disclose at this point? Hearing none, I need a motion for the approval of the agenda.
So move.
Second.
All in favor? Now I need a motion to go into public hearing.
So moved.
Second.
All in favor?
Aye.
Okay, Ms. General.
The first public hearing is for a petition to name a private road, to assign a name to a private road of approximately 450 feet in length, which connects to Mordecai Lane in the Bath Township. The proposed name is Nirvana Circle. If anybody has any comments on that, you can come up at this time.
Hearing none.
Motion to close.
Second.
All in favor?
All in favor of what? Getting out of
We're just getting out of this and we'll start.
Okay, getting out of the
Number one. All right. Okay, Jamie, we can go to
The second public hearing is for a petition to name a private road, to assign a name to a private road of approximately 1,000 feet in length, which connects to Frederick Road in the Chocowinity Township. That private road is located approximately 3,000 feet south of the intersection of Frederick Road and NC Highway 33 West. The proposed name is Trejo Road. That's Trejo Road. If anybody has any comments on that, you can come up at this time.
hearing none. Motion to close.
So moved.
All in favor? Motion to go into the last session of public hearing.
And the third public hearing is for a proposed text amendment to the Beaufort County subdivision ordinance, which clarifies the number of principal residential dwellings allowed per parcel. If anybody has comments on that, they can come up at this time.
Motion to go into the public hearing for this particular item.
Second.
All in favor?
Sorry, go ahead. Should I go through that again?
No, we're good.
We're good. Hearing none.
Motion to close the public hearing.
Second.
Thank you. All in favor? Thank you, Jeremy. Okay, we're going into public comments, and we have Miss Mish up here first.
Good evening, Chairman Evans, Commissioners.
Could you speak in the mic, please?
Sure, Stan. Commissioner, sorry. Thank you. I'm speaking about the detention facility again, using the word jail as before. Has planning for a new jail begun? Are we waiting for a catastrophic event or still in denial? When the power goes off, security cameras fail, and the doors in the jail are in failure, how vulnerable to tragedy are we? Is this not the loudest of wake-up calls? How can we walk around with the knowledge of this, our jail failing is a failure, as it cannot be denied the power has and does go off in the jail? We are all held hostage in this county by the elephant in the room. That is, this project was once a green light. Here we are again with no accounting for the human factor when punitive budgeting takes the day. Locked up by hardline ideology, no matter how badly we need a new jail. It states on our jail website the noble words honor and dignity. What kind of honor and dignity are we giving back to those in the Sheriff's Department who are called to work so hard on our behalf, who do just that, serve instinctively, selflessly, empathetically to give honor and dignity? What have we done to those in uniform who faithfully go to work putting their lives on the line to honor their duty to maintain our civil society? What level of disrespect is this, leaving them to bear the disaster we call a jail? To be party to what in this 21st century is not even a faint resemblance of what a jail should be. We disrespect their colleagues in uniform, the firefighters, the EMTs, called to the jail who cannot maneuver their stretcher for constraints of the space. What about disrespect of the jail staff who have no means of decontamination of their person, who are sent into peril with their wards during evacuation, forced to leave their families behind, stand in as human sally ports? Are not the volunteers who offer so much toward detainee rehabilitation disrespected when turned away for lack of space in the jail? And here we stand with no iota of respect for the plight of the detainees who need to get their lives on tracks, the unfortunates who need but don't have access to video counsel with their attorneys because, again, lack of space in the jail. We are pathetic. What has this battle of the jail reaped? What has it done to the morale of those living with it daily? Where do we stand on morale for our community? Here are the issues where we have gone astray that can only be rectified by having a new jail. Inadequate staffing, security, insufficient storage space, no lavatory in the medical area, no secure conference room, no room for administration and their offices, no secure transitory passage between the outside and the jail, no staff bathrooms, no staff showers, inadequate housing where detainees need to be kept from one another or have special needs. Are we still not getting the reality here? The physicality of the jail is not working. Where are we now in the number of federal civil rights lawsuits that have been spawned by our jail? The Beaufort County Jail has an unfortunate Wikipedia page referencing 1974. Do we want to become an addendum on that page, where we are another case study for law students and public administration students, using as an example the legacy of what went wrong here when we were mandated to build a new jail and why so far it hasn't happened? Can't we do better? Let's build a collaborative community. Visit the collective town hall, our waterfront, where this needs to be a new conversation. Take advantage of one of our greatest amenities, the fresh air that comes off our beautiful river. Clear our heads and work with neutrality when making decisions on laying the plans for a new jail. Dear Chairman Evans, the dire need for a new jail proved to me unavoidable since a grand jury tour of the facility left me baffled last November. Despite the turmoil and long-term politicization of the issue, we still need a new jail. The nature, structure, and cost of keeping this antiquated facility crippling along needs to end. I ask you to bring this issue immediately before the board and begin a plan for a new jail. We must all encourage community support, and with all stakeholders included in the conversation in support of the commissioners in this task. Clearly, an organized effort needs to begin to correct past misinformation and entrenched mindsets. Our citizens who've never toured this jail need access to informed discussions and presentations given and sanctioned by our Sheriff's Department, the DA, and our commissioners. A new jail built with professional oversight specifically for our community needs, one built with guidance avoiding mistakes from planning to opening, is the crucial step we need to take. Please invite the National Institute of Corrections for planning here now to get this started. I'll leave a copy of this letter with the clerk, Ms. Mosher. Thank you so much.
Thank you, Ms. Mosher. Mr. Anderson?
Good evening, commissioners and citizens of Beaufort County. My name is John Anderson. I'm the uncle of the deceased Corey Anderson, who was my nephew. He was an inmate in the Beaufort County Jail. Corey is no longer here, able to speak for himself. So I'm here to speak for him and on behalf of my family. 1 year ago this month, the sheriff appeared before you. One of the things I recall from that night as we were here in attendance was a comment he made on the policies of the jail. And this is what the sheriff said using his words. And definitely they're not my words, but these are his words. He said, these policies, there are policies on everything from sneezing to farting in my policies. And for everything, we go by the book. That's why I said those weren't my words, they were his. Anyway, with that being said, we've been asking for one of the sheriff's policies since May of 2017, which is when Corey died. In November meeting, Chief Deputy Rose appeared before you, us, and other citizens of this county. He brought forward a notification policy from the sheriff. We thought this was a policy we've been asking for. However, when the meeting went into closed session that night, exiting to the foyer of this building, we asked Chief Deputy Rose why wasn't Corey's emergency contacts called, noting the policy that he had just presented. Chief Deputy Rose told us that the policy he had just presented was not the same policy that was in effect when Corey was hospitalized in May of 2017. We asked him again that night for the policy from the sheriff, the one that was effective in May 2017. We got no answer. Since that night, we have continued to send requests under the North Carolina Public Records Law, General Statute 132-1, to the sheriff. We sent one in November. The reply back from the sheriff's office did not include the policy from May 2017. We sent another one just last week. We're still waiting again for the sheriff's reply. This is where we stand now. We continue to try to find out what the sheriff's policy was as of May of 2017. We still want the answers. We still need the answers. And it's just the right thing to do. Any family would want the answers to what the policy was, seeing as how Corey's emergency contacts were not called. Corey died in the hospital without ever seeing a family member before his death. The sheriff will not meet with us in his office, so we asked tonight for the sheriff to come before you. This is a plea to him to come back before you, before us, the people of the county, as he did last February, and bring the policy that we're asking for. This policy is a public policy, and by law, the sheriff, being the custodian of this policy, is to provide this to anyone who would request it. In another statement made by the sheriff that night in reference to the commissioners, he says, you're either one of two things. You're either ignorant to the laws and rules, and I don't think you are, or either you're doing this on purpose. So I want to use the sheriff's quote that he used back to him, that he used to you guys back to him. This is either one of two things. Either the sheriff is ignorant to the laws and rules, or he's doing this on purpose, that is, keeping the policy away from me and my family. I don't think he's ignorant, nor does my family think he's ignorant of the laws and rules. I just think he's keeping them from us. Nor do I think, or my family think, that he cares how much that this could eventually cost the county. If he did, I believe he would do more and would have done more, including anything that he could do in order to help me and my family find out what the policy is, why Corey would be allowed to die without ever talking to a family member, why no one was ever called. Lastly, I ask you commissioners, how many of you guys truly care, and I'm piggybacking on some of what was said a while ago before I stood up by the lady that spoke about the jail. How many of you guys truly care about the health and welfare of the inmates and citizens of this county? Commissioner Richardson has worked with me in some way, shape, or form, at least been a listening ear for me. No one else that I know of you commissioners have been willing to do that. So I'm asking you tonight, how many of you really care? How many of the citizens of Beaufort County really care about what I've talked about since May of 2017 concerning my nephew, Corey Anderson? That's the question of the night, maybe the question of the day, maybe the question of this whole thing. Does anybody really care about what happened to Corey? If you do, then I'm asking you guys as commissioners to at least see if you can get the sheriff to come back and talk to us and at least tell us what the policy is. That will give us a little bit more understanding about why maybe things happened to Corey like they did. Thank you guys for the opportunity to speak tonight. And thank God for this country, the United States of America.
Thank you, Mr. Anderson.
Yes, sir. Thank you.
Mr. Peterson?
Yay.
For the presentation.
Yeah.
Three people.
There's only two. Don't give me all of that. Maybe it's to the agenda. This is just be
Good evening.
Trying to hit that lights back there.
Actually, it should be on the remote key. On the remote.
That's shorter.
There should be a volume.
It's feedback. Sound a little bit of feedback coming through.
Well, thank you for having me here this evening. Once again, my name's Dave Peterson. I'm the Central Regional Director at Trillium, and I've presented in front of you for the past 4 years. And so you look familiar. I know you're new, but I think about 4 years ago,
Yeah.
I think we have met. So,
Maybe longer.
yeah. So I first want to say a couple of things. I want to thank Commissioner Langley. He is the chair of our Central Regional Advisory Board, and this is his 4th year of doing that, and I really appreciate the effort that he's put forth. And he meets with me on before the meeting to go over the agenda and advises me on what needs to be talked about. I also want to thank Jim Madsen, who's on our Regional Advisory Board, but he was appointed by the Regional Advisory Board to be up on our governing board. So Jim does play a role on our governing board also, and so thank you, Jim, for working with us on that. So I want to do our annual report for y'all, and briefly, our mission is transforming lives of people in need by providing ready access to quality care. These are the topics I'm going to hit tonight on our coverage changes, some very, very big legislative changes that are coming our way, some funding changes, partnership changes, organizational changes, and then at the end, some county-specific data to Beaufort. As you can see, we are going to get ready for some major changes coming up. But before we do that, this is just who we are. We cover 26 counties. We have a total population of about 1.4 million. And I use that as an example because there's another managed care organization in the state that only has 4 counties: Wake, Johnston, Cumberland, and Durham. And those 4 counties in that managed care organization still has 400,000 more people than what we have in our 26 counties. Okay? And so that being said, we have 205 Medicaid-eligible individuals. Last year, we served about 54,000 people for mental health, developmental disabilities, and substance use services.
What folks sometimes misunderstand is that we do the services. No, we do not do the services. We contract those mental health, developmental disabilities, and substance use services out to about 500 provider agencies in our 26 counties. Last year, service cost was about $355 million. Okay? We manage a wide variety of counties. Terrell County is our smallest county that we manage at 3,800 population, and New Hanover County is the 8th largest county in the state, and we have everything in between, including Beaufort County. We cover services over 12,000 square miles in our catchment area. This is just a map of what we look like, and you can barely tell the difference in the green. The little bit lighter green in the top region. There's 10 counties in the northern region. Check out the population of those 10 counties. A little over 200,000 people. And then the central region, which I'm the central regional director, including Nash, which isn't congruent to us, or contiguous to us, but then Pitt all the way out to Dare County. We have 2.5 times the total population in the central region than in the northern region at almost 500,000 people. And in the southern county, which includes New Hanover, of course, they have over 700,000 people down there, and there are only 7 counties. And so we have a wide variety of services and supports that we have to lay out to each of these counties. So on the coverage changes, you may recall 2 years ago that Nash County wanted to join Trillium from another managed care organization. Well, this past year, the Secretary did approve that Columbus County, the Columbus County Commissioners said that they wanted to join Trillium also. And so that's why we are now up to 26 counties, because Columbus County joined us in July of 2018. We wanted to make sure we were trying to give them some more provider options that they needed in Columbus County. Some of our largest providers went into Columbus County, including Port Health Services and Integrated Family Services. We've done a variety of different requests for proposals for specific services in Columbus County to try to get their needs met for services on mental health issues. This is one of the biggest changes happening as we speak. I've been doing this 35 years. This is a biggie. Okay, we have the legislators a couple of years ago had said that they wanted to develop a standard plan and a tailored plan. And it was interesting. This morning I was presenting at Nash County Commissioners meeting, and I said sometime this week the state is going to come out with who they have chosen on the private insurance company side that is going to be getting the standard plan. Well, at 2 o'clock today, so Nash County didn't hear what you guys are going to hear. Today they announced the private insurance companies that are going to be managing the Medicaid dollars that we used to manage, okay, for the low-risk individuals. So AmeriHealth, Blue Cross Blue Shield, United Health, and WellCare are going to be the ones managing the insurance companies managing the low-risk individuals. There were a total of 8 applicants, and then so Aetna and Optima Health did not get the contract. Okay, very large national and private insurance companies did not meet the standard of what the state is asking. There was 2 other applicants. Carolina Complete Health, which is a provider-led entity managed by the North Carolina Medical Society. They did get the contract to manage 2 of the regions. But another company that's managed by the North Carolina Hospital Systems did not get a contract. And so, that being said, we currently manage all the low-risk, medium, and high-risk individuals. All right? And I use the example, if an individual only needs some basic outpatient services once a week or once a month, those are going to go, Medicaid services are going to go over to the private insurance companies now. Okay? So that money that we manage now for the low risk will go over to the private insurance companies. We will continue to manage the high risk individuals like we have been doing for 20, 30 years. All right? What that means, though, is two things. The total number of consumers that we serve is going to go down because the low-risk individuals are going over the private insurance company. But the other piece of this that the state has put into this bill is now we're going to be managing the whole person, not just their mental health issues, but their primary care issues also. So we're going to be having to contract with all the primary care offices that manage Medicaid. We're going to have to be contracting with pharmacies and a variety of other pieces to treating the whole person. So when you look at it that way, yes, we're going to be serving less individuals, but we're going to be serving the whole person. And so those are the big changes in the sense of the legislative changes. It's all supposed to be budget neutral. All right? So that being said, there's a lot of work that's coming up, and I'll give you a timeline. So this is both for the standard and tailored plan. I didn't predict it to happen today, but it happened today that they made that announcement of those insurance companies. In July, those private insurance companies, and I'm not sure if you have ever needed to call Trillium, but currently we do have a 24/7 call center, all right, with licensed clinicians. Well, the private insurance companies are going to have a call center set up by July, all right. Then in July through November, they're going to be starting to set up the regions in which they are going to be rolling out the plan, and they're going to be rolling it out in 2 phases. And in the notice today, the phases that were starting early were not necessarily ones in our catchment area. So the good thing is those 2 phases, or the first phase, we'll get to see what difficulties they have in the other part of the state. And then in February, or I'm sorry, in November, the first phase goes out, and then I believe it's in March of the following year, 2020, the second phase gets rolled out. But it will also, the state will be throwing out a request for proposal for us to apply for the tailored plan, the high-risk individuals. So it's not like we have it, but I guarantee we are the best MCO in the state, so we will get it. I'm almost positive. So that being said, in May of 2020, the state will award the tailored plan. And right now in the bill, it says 5 to 7 managed care organizations will get that. And right now there's currently 7 managed care organizations overseeing that, and we're one of them. So the likelihood of us getting it is very, very high. We'll have a readiness review in February, and then July 2021, we roll out the tailored plan. 2021 may sound like a long ways away. It really isn't. So some of the funding changes that I was talking about, so the standard plan insurance companies that I mentioned, they will be getting some of our funding, all right, and to manage those Medicaid dollars. We will be covering the higher risk individuals, but our per member per month, the PMPM, will be higher because these folks are the most difficult individuals to manage. But like I said, our numbers, total numbers of people that we will manage will be lower. And that we'll be managing the whole person. And this is as the state moves towards this new 1115 waiver in order to implement this system, which is, once again, cost neutral. So some of the partnership changes is because we want to make sure that we get approved when we apply for the tailored plan, we have partnered with 2 other managed care organizations in the state, Alliance, which is the central part of the state, Wake, Johnson, Cumberland, and Durham, and then VIA, which covers 23 counties in the western part of the state. So we have, between the 3 of us, a majority of the counties underneath us. But once again, this isn't a merger, but we're doing a lot of meetings with those 2 other MCOs on how we can make sure that when we do apply, that we have the best foot going forward between the 3 MCOs on what does VIA do really well that we don't, what do we do really well that the other 2 MCOs don't do well, and try to make sure that our applications are strong. Okay? And since we just got notice today about who those insurance companies are, we're going to have to be partnering with them on how to transition the individuals over to the private insurance companies that are low risk. So with that being said, some of the organizational changes, you heard me mention that we're going to be treating the whole person. We are going to be doing a lot of work trying to make sure that we're addressing the social determinants of health. And Jim Madsen has been working on social determinants of health for the past 6, 7, 8 years and is very knowledgeable of that. And we're learning what are the needs out there for just the basic health needs. Trying to make sure that housing, transportation, healthy eating habits are being addressed through this through the social determinants. So we are going to have staff to oversee that. We will need to make sure that we're working closely with the DSSs and the health departments in this transition, because they manage a lot of the same individuals that we manage. And with that being said, we are going to need to be hiring another psychiatrist, because we were paying money to outsource the utilization management of all the denials of authorizations, and we're bringing that in-house now and needing a psychiatrist to do that. On the opioid funding, you may recall that the feds gave some cures funding, and last year Trillium spent a little over $3 million, and we served 1,880 individuals with that $3 million. We have been participating in a variety of opioid coalitions, and Beaufort County has been part of the second judicial district opioid coalition that is pretty aggressive on going after some federal and state grants to help address the opioid issue. On another big event that obviously has impacted a lot of us, we had a lot of internal and external tasks dealing with the hurricane. And so we put out a web page and got about $30,000 donated to us for food, clothing, and hygiene. We had 4,000 care packages delivered to various shelters. We had 1,500 comfort kits for children put together. We stocked the pantry for our transition to community living members, which is under a class action lawsuit at the state. We had 1,000 backpacks that were all packed by our counterpart in the western part of the state, Cardinal Innovations, and they delivered those to us. We also applied for a FEMA grant, which is called Hope for NC, and we are working on trying to make sure that that gets into every county to help folks get connected if they're needing services and supports in relation to the hurricane. This is the last bullet is a prediction of what potentially could occur because of the devastation of the hurricane. A 2 to 4% increase in services for adults needing mental health services, a 50 to 60% increase in services for children under 13, and a 35 to 45% increase in services for kids 13 to 18. We have staff on the ground seeing a lot of different responses to how people are dealing with the hurricane. Some have been immediate right after it occurred. Some people, it's now just starting to hit them because they still aren't back at their home. All right? And so we're really trying to work with folks to get back to where they were before the hurricane. One of our system of care staff was listening to a FEMA expert that was in Craven County about a month or two after, and basically he said to the New Bern folks, this is a 3 to 5 year process to get this town back to where it was. And so it's had a great impact on our communities. So lastly is the number of individuals that have been receiving mental health, developmental disabilities, and substance use services. For Beaufort County, we had 2,880 individuals total. We had 2,241 receiving mental health services, 752 receiving substance use services, and 334 receiving intellectual and developmental disability services. But if you try to add that up, some of these folks received duplicative services, and so it's much more than the 2,880. Okay, so. And that's my annual report, and if any of you have questions, I'd be happy to answer.
Sure. I have 2 questions. Are y'all totally government funded, or do you take donations?
We are 85% of our budget is Medicaid, about 13% of our budget is state, and about 1 to 2% of our budget is county. And so we are a state/local government-run agency, yes.
But the second question is, when you said that you're all going to care for the whole body, is that housing too?
Yeah, we have a housing department right now that does a lot of, they apply to a lot of federal grants for housing. And we've been doing that for a long time. We are just now going to be needing to step that up a little bit more. It's not that we are going to be providing housing. It's of the money that we have now, because we're not getting any additional money. But we are going to be trying to make sure folks are linked to the appropriate housing resources. That will be a function of this.
I have one more question, Mr. Chairman.
Sure.
Charlie. In this housing, do you use group housing or single dwelling housing, or?
We have all varieties of housing. We have group homes, we have independent living apartments, and we have services for individuals that are in their own home where we go into the home. So we do a variety of types of living arrangements. We had to convince the state what their definition of housing was in regards to the class action lawsuit, because the class action lawsuit was trying to get folks out of the state psychiatric hospitals, but they would only consider bricks and mortar as housing, and we said you need to take a look at trailers and mobile homes as housing also. And I think this past year, after 4 years of negotiation, they finally consider that now housing. Because
Mr. Chairman, I heard you say that these 4 private insurance agencies have to have a call set up. I think it was by February, by March.
By July.
By July.
Yeah.
Now, do they have to be in our captured area, or they can just be in anywhere in North Carolina, or do they have to be in our area where our people, just as long as our people can be accessible to it?
Yeah, it's a call center, and so like our call center right now is just in Greenville, but we cover all 26 counties.
Okay.
And so it'll be someplace.
So each one of those private entities is going to have someplace in our region.
Well, someplace in the state, because those 4 companies are going to be statewide.
Okay.
Yep.
Another thing, I saw 356 million, 355, well, it's close to 356 million and 555 providers.
Yeah.
How many of those providers was in our Beaufort County area?
I don't know the number off the top of my head, and I can get that number for you, though. But we have, and let me clarify, providers can be a single licensed independent practitioner, okay, to a company as large as Easter Seals, that has 500 employees.
Okay.
Okay.
So the numbers are just out there. I mean, they're real dollars.
Yes.
But because it's 555 vendors, that means it could be, like you said, several different participants.
Yep.
Thank you, Mr. Chairman.
Mr. Peterson, let me ask you how many psychiatrists you have for 26 counties?
Trillium has one.
Anyone else?
Well, how many consulting psychiatrists do you have in the district that serves the district?
We have a contract with a company called BHM, which is a national company. And I don't know the total number of employees that agency has.
Mr. Chairman, I have
Yes, sir.
one question. So,
Very fine.
when you set up these housings, whether it's a group house or a single dwelling or whatever, do you have any problems with the neighbors that live close to them?
It's all about education, and I think you're referring to all the NIMBY issues out there. And I think the more we educate, there was, and if folks are familiar, there was an Oxford House, which is a national model that just opened up in Nash County, an 8-bed or an 8-room house out there, and they went around the neighborhood and started talking to folks. And I was there at the grand opening a couple weeks ago and talking to some of the clients in there, and they've said they've met the neighbors, which that in itself means they've done the reach out for that. Right. I'm a believer in making sure, because you shouldn't have to hide that.
I agree. Thank you.
Thank you, Mr. Peterson.
Thank you
so much. Okay, we're down to items for consent.
Motion to approve.
Mr. Chairman.
Yes, sir.
I have an item I'd like to take off.
Okay.
And review.
Okay.
It's the it's the schedule for our workshops. I got
10.
What item is that?
10.
Number 10, yeah, there it is. I'd like to discuss that a little bit later on.
Anyone else? Motion to approve the amended.
Yeah.
You have a motion?
Yeah, I made a motion. I just amended it.
Second.
All those in favor?
Mr. Chairman, we can discuss the budget workshops. We'll discuss my item that I'm bringing up to discuss the fiscal budget, 2019-2020 fiscal budget, if that would be okay with Commissioner Brand.
You said putting them together.
Yeah, put them together.
Okay.
4 hours of deliberation.
That's tonight.
Need a motion to, I need a vote on, vote for approval of the amended agenda.
So moved.
So, we got a second. Everybody vote?
Oh, I haven't voted.
Okay. All those opposed? All right, the motion's approved. Brian, did you want to bring up the workshop now?
That's her. The board would like to take it.
So Stan wanted it with his
Should I discuss mine now? My issue?
Where is it up here?
It's down like the 620, 625 hour. So we're getting kind of close.
Okay.
What's that?
We can do it now if that would be the wishes of the board.
I don't care. We got to hear you sometime.
That's right. You sure do.
Huh?
Loud and clear, too, I hope. You're going to be listening loud and clear?
All right. Thank God.
What you got?
The reason that I wanted to take that off and discuss it was the meeting on 3/4/19. We're going to be in Washington, D.C.
That's actually not a meeting. It's when that's when the expansion budgets are submitted. That's when the budgets come back to the staff. That's not actually a.
That's not actually a workshop.
No, sir. Not the workshops are listed down at the bottom where it shows budget workshops.
I got you.
Yeah, he's over there.
Pretty good.
That's all I got.
Thank you.
Is that all the action you need on that one, Gary? That's all the action you want on it? Is that all the action you needed on that item?
Yeah.
Okay.
This good question's been answered. Go ahead.
Then if the board would entertain a motion on that, we'd go ahead and.
Second.
Second.
This is on page 42, right?
Yeah.
Okay.
All those in favor? Any discussion? All right. Thank you. All right, items for discussion. Commissioner Richardson?
Well, I asked the manager to give us an update on the FEMA flood maps for the public's information to know what this is about. We're spending about $5 million a year, people of Beaufort County, to buy flood insurance, and all we need is the maps to be approved so the commissioners can approve them so they can be enforced by the building inspectors, and you're going to put $5 million in your pocket. We've got people that are paying as much as $4,000 and $5,000 for flood insurance, and some of those people won't even have to buy flood insurance if we can just get this stuff approved.
I'm just, Mr. Chairman, is that fair?
Yes, sir. Yes.
I'm just wondering, the reason that Ed and myself and our lobbyists didn't go to Washington, D.C. because of the shutdown. And I'm just wondering, is there lobbying in the State House and Senate and in the United States Senate to keep this in place?
If I can address the overall piece, and I'll catch that as we go through. If you'll recall, we reported at the last meeting that the letter of final determination, which is the letter that the state submits to the federal government, to FEMA, to request approval of those final maps, was submitted in January. During that time, the federal government was shut down. We've received no update from FEMA since that time. I have reached out and contacted Senator Burr's office, Senator Tillis's office, and we've had conversations with their staff. That was during the shutdown. They told us that as soon as the shutdown opened back up, that they would have their lobbyists or their legislative folks work on that. They both recognize the issue very clearly. We have not had any contact with Representative Jones's office, simply out of respect for the situation that's going on right now. And for what I understand, it's simply a matter of it processing through FEMA and that letter coming back. Don't know what impact the federal government shutdown has had on that, how long it's going to take them to get back up to speed. But that's the update that I have as of today.
Okay.
The employee travel policy is the next item.
Yes, go ahead.
And it came up at the last meeting when the auditor discovered that there were some expenses that were being paid without receipts being submitted. There is a copy of the travel policy in the book, and I've read through it. And the only thing that I can find in there, because it is very clear that you're going to have receipts, and they have a per diem set up for each day by each meal, for what is allowable for meals for county employees that travel. And the only thing that I can see in there is, even if you're collecting, and this is a question, even if you're collecting per diem or per diem, whichever way you want to pronounce it, even if you're collecting that, you still have to have receipts, because the purpose of the per diem is when you spend more than what has been allotted. So you still need receipts for your meals. Is that correct?
That's correct.
Okay, and that's a clear policy. Employees understand that.
Yes, sir. And if I can clarify, the comment made by the auditor was that, and that was an opinion by the auditor. Actually, the auditor, in doing a test of reimbursements, on one reimbursement found a non-detailed receipt. All the receipts were present, but it was not a detailed receipt. An example may be like a credit card receipt that didn't say you bought a sandwich and a drink and a dessert. It just had the final credit card bill. So what the auditor recommended was that there be detailed receipts. It is not a violation of our policy. If you'll look on page 150 of your agenda book, under section 4, item A, number 2, it reads reimbursement from the county. All reimbursement requests shall be supported by original receipts and signed by the employee and his department head prior to submission to the county finance office. So we are doing that, and what the auditor suggested was their opinion. We were not in violation of our policy. Our policy is you turn in an original receipt. It doesn't require you to turn in a detailed. We do internally ask that be the case, and we enforce that internally. The reason I would recommend to you that you keep it the way it is that we address those issues when detailed receipts don't come in. We tell folks that that's unacceptable, and that they need to do that. If it continues, then we do not reimburse them. My concern is if you write in there detailed receipt, then if somebody misses one, which occasionally people will miss one, then we will be violating our policy. If we say, like it is written now, that you turn in a receipt, then we have not violated our policy. We internally control that. The finance office reviews those receipts to make sure that they are what they are and they're reimbursing what they're supposed to be reimbursing. And that would just be our comments on that.
Most modern receipts today that are original receipts have enough detail on them so you can see what's going on.
What happens is when you take a purchasing card or a credit card and you pay for some item, sometimes it will include the detail on that, and sometimes it will just be the receipt for the credit card that just says you paid $15 where you sign. So what we always ask our folks to do is that they attach that detailed receipt, and that may be the menu item that came off with it or something. So we are doing that.
I don't, with that explanation and having read that policy in detail, I don't have a problem with the policy the way it stands today.
Okay. Beaufort School District.
Well, we paid for NC State. They made an appearance before us about a year ago to do a study to develop a database on how to efficiently district not just schools but transportation and a whole bunch of other things. And we do not have a report from that yet. And they estimated when they were here that it was only going to take them a couple of months to get to where they had a report. So my question as a commissioner is, where is the report?
Be glad to answer that. Had a conversation with Thomas Dudley, who is with NC State, the ORED group. In their initial work, they were relying upon contact with the former superintendent. And during the process of which, when Dr. Phipps left, that process pretty much went on hold. As you recall at our planning retreat, Mr. Cheeseman, who's the new superintendent, has been in contact with them. We've talked. My last conversation with Mr. Dudley was that it would take them about 6 weeks to complete the project, and they are back on track now with that. We have not paid them any money as of yet.
So what's the due date?
He said about 6 weeks. They've already requested the additional information from the school system. They need some updated information, and they have their direct point of contact now with the superintendent. So 6 weeks from last week.
Okay. Ready for
All right.
Yep. Go ahead.
Oh, no, we don't need to do that. I came in today, got on the computer, checked it out. Looks like it's been blocked. Looks like Twitter's been blocked as well.
Barracuda.
Barracuda.
If I could address
Talking
that.
about Hart, band Hart, Barracuda.
No, that's the county's defense system.
Is that it?
If I could address that, please.
Barracuda is engaged. Is that what you're saying?
Yeah.
In conversations with our IT folks, the Barracuda Web Security Gateway was implemented in February of 2011 and has been under place since then. We block all social networking sites We do that through what is called content filtering, and there's a ton of other things we content filter on. And we also have web application filtering. So the comment about Facebook, that's blocked under content as a social media platform, and it's also blocked under the web application under the Facebook piece. So
Does that include the sheriff's office?
the sheriff's office has a couple of computers that are not blocked, and they use that for investigative purposes, because you'll be amazed
Makes
at what
sense.
people will
makes
put
sense.
on their Facebook page.
Makes sense.
Oh, boy.
But there is there's a content filtering policy that the county has for our IT folks, and there's some standards that come through Barracuda, and then we can change the defaults. But the majority of the stuff that you shouldn't be looking at is blocked, and it works very well.
Well, it is a big time usurper, so
Okay.
it's good that that's taken care of. I thank you.
19th.
When I came in for my first meeting, it was completely open.
I'm sorry. I think what may have been, we asked our IT folks about that. What may have been is you may have had something cached on your
Yeah.
machine or cached on your phone.
I don't know.
But they
I
checked
was
it.
able to navigate. Now, I will tell you this. All the years I was commissioner before that, Chrisman and I, we didn't even bring it to commissioners. I said, let's block it. And he said, I'll get right on it. So it was blocked. It stayed blocked. And it stayed blocked all through the last 4 years. And then all of a sudden I get on the board and it's unblocked. I thought I'd make mention because it is a time waster.
You ready for 1920?
I am. And I'm glad I'm segueing into this after looking at the budget sessions, and they seem to be at a good time early in the month of May and middle of May, and looks like we're going to try to get this budget knocked out early. Now, it also appears that we have enough budget workshops. We may need to engage in some of these shops for enough time to seriously examine the budget, examine what we need to do. But if I could digress back to when we met in our retreat with the school system, with the new superintendent, Matthew Cheeseman, he stated that he is strenuously going to advise his board to look at their budget on a zero-based budgeting method as opposed to a baseline budgeting method. Now, Beaufort County has long used the baseline budgeting method rather than the zero-based budgeting method. To explain that, the zero-based budgeting method, which I would prefer, and which Matthew Cheeseman, Superintendent Cheeseman, is going to prefer, is to take each line item, examine it, and ask each department head to defend the expenditures that they bring forth. And then we as commissioners, through oversight and budgeting, we figure out how much we think they should need, and with the help of the manager. And I know there's going to be a lot of discussion about that, and there's going to be a lot of research done by all of us to effect a proper budget. But I would like for us as commissioners to engage in a zero-based budget process, at least consider it, rather than a baseline budgeting process. Now, I'm bringing this up in February because we have 3 months before we're even going to be getting into the meat of this. So I want to talk seriously about it tonight and see what my fellow commissioners feel about this, and if you have any ideas to offer.
Well, I support the zero-based budgeting. I think we need to look at more things than we look at, because there's a lot of stuff gets wasted and buried in the budget. I mean, after all, our budget is about $60 million a year? It's a lot of money. And when all you're doing is adding to last year's expenses, you don't know what you've left out. You don't know what's duplicated in there. And we need to, I support the zero-based budgeting, and I've already made a motion prior to this that if we can't do the whole budget with zero-based budgeting because it's a lot of work, that we take part of the budget and do it as zero-based budgeting.
And I bet you know exactly what part to do the zero-based
I'll take any
budget.
parts, because whatever parts we don't get this year, we'll do next year, so we'll eventually get it done. But I want to ask one more thing. Now, we're supposed to have some numbers tonight, Anita.
Yes.
Do you have those?
I do. I have a handout. It's on executive size paper.
Is that-
at your desk?
Are you going to have, with permission of the board, you're going to have to explain this to us.
I'll be happy to.
But you're going to need a magnifying glass.
I apologize. It is a little small. It's a lot of information. So at our budget planning retreat last week, Commissioner Richardson did request that we provide 3 years history on the county budget, and you'll see that on the sheet of paper I handed out tonight. So what you'll see is both revenues and expenditures for fiscal year ended 2017, fiscal year into 2018, and then the current fiscal year. And as I was putting this together, what I noticed is we've had a lot of changes in our programs and services over the last 3 years, and it didn't seem like I could just provide you with the raw data because it's not comparing apples to apples. So what I attempted to do at the bottom is I tried to make adjustments in each year to try to account for those changes in services and programs. And a good example of that would be, I think, the school resource officers that were added in this current year that we're in. So, you know, that bumped up this year's budget, and we did a tax adjustment to account for that. But if you look back at fiscal year 2017 and 2018, of course, those funds aren't in those years, so I added that back for those 2 years to kind of try to get us to an apples-to-apples comparison. So I'll try to give you a few minutes to review it and answer any questions that you may have. And I did just try to capture the very large items because, you know, everything changes from year to year.
And that, in conclusion, I'm going to use that as a segue to my conclusion.
No, we got motions. I want to make a motion.
You want to make a motion?
I want to make a motion that we take part of this budget, or that we take 25% of the budget and do it as zero-based budgeting this year.
Okay. And then I'll
That's my motion.
Very well.
You want a second?
I'll second it. And then I would like to say what I was getting ready to say. Okay. In defense of Hood's motion, which I'm seconding, if the school system is going to use zero-based budgeting for 100% of their entire budget this year, just so this new superintendent can get a handle on the expenditures to better allocate funds, we commissioners, Lord knows, we commissioners can look at 25% of our budget closely through a zero-based budgeting process. And that's the conclusion of what I bring forth, and also to promote that we all join Commissioner Richardson on this issue.
Anybody else? Discussion?
Brian, would you or Anita explain the process that you go through now with each department head?
Yes, sir. Be glad to. The process overall is that we have a budget planning session with the board to give us direction on how they wish for us to proceed policy-wise. If there are any changes at that time that they want to give us for policy reasons that may impact how we put together a recommended budget for you. From that, we go to our department heads, and they are given prior year information. They have access to Munis, which gives them all the information they need on all expenditures going back 4 years, 5 years. And what we ask them to do, we give them a spreadsheet. We first ask them to roll up the existing year to let us know where they anticipate finishing out the year. And then we ask them to plug in what they're recommending for the next year. They do that by going through their budgets, by looking at historical data to determine where they need to be. That information is rolled up in a line item budget and presented to the finance office. We then, the finance officer and I, along with the department head, sit down in my office and go through those budgets line by line. And essentially, they take their first cut, and Anita and I take the second cut on it. We look at those. Anita and I have our computers where we see Munis, and we have conversations with the department heads at the time about each individual line item and where they are and what they've requested. Sometimes we'll look at it and say, looking back at the historic data, and say, this doesn't look right, you got too much in here. We may say you don't have enough in here based on what we're seeing. So we adjust those numbers based on that individual conversation on a line item basis. We then roll that up and it gets presented to you, you get in your recommended manager's budget, you get the individual line items, and then you get a rolled up summary of each department, and then at the front you get a rolled up department, so that you see it in as much detail as you want to. I think we show 3 years. We show 3 years back, and then we show going forward recommended. The board then gets the budget, and we take it in as much detail as you want to take it in. Our offer to the board at the planning retreat was we're happy for any of the board members to come and sit with us during the time that we review the budget, but we just need to know how detailed you want to see it. You see it at the line item level in your recommended budget when you get it. If you want to see more detail than that, we're certainly glad to give you access to Munis and have that available for you however you'd like to do it. I would say for the board, if you want to go line item by line item, we're going to need more budget sessions.
So you said we have access to Munis. We can sit down at your central computer and look at it, or can we use up I could tap in my computer into your space, your URL? Or,
you can do it on my computer.
On your computer?
We have to get you set up.
We would have to get it set up, yeah. If that were the case, we can get our IT folks to set it up. It's not available from outside. But
yeah, it would be nice for the commissioners to have a portal in the Munis. Just one portal, and we could all just tap right in there whenever we want to. It could be in an undisclosed location, so only we know where it is.
If you're interested in doing that, we can set you up. You're receiving monthly updates on the budget. If you'd like to get in more detail, you're certainly happy to provide you that detail, and you can get into Munis, and we're happy to do that for you. It's whatever the board wants.
Okay.
How much flexibility is there in that budget? When you're sitting there with a department head, certain things are mandated either federal or at the state level.
Here's the dirty word that we keep using every year that we get beat up on.
How much?
But again, as I've done for the last however many budgets we put together, I want to explain that. What we call a continuation budget, which unfortunately has been termed to be something terrible, is we ask the board during the process, are there programs or services, policy level decisions? Because the Board of Commissioners is the policy setting organization for this county. It is not the county manager, it's not the finance officer. The board sets policy and we follow through with that policy. So from a policy perspective, if there are programs or things that you don't want and you want us to change, then we need for you to tell us that. Absent of hearing that, what we present to you in a recommended budget is what it takes to do next year exactly what we are doing this year. Anything different than that, we bring to you, it could be a plus or it could be a minus, we bring to you in what we call service expansions. Again, people have seized on service expansion. When I say expansion, I mean plus or minus. You may have a department head come in and say, this is not working, I want to take this out. Then what we would do, because it is a policy decision from the board's perspective, it's not Brian Alligood's budget, it's not Anita Radcliffe's budget. It is the budget of the Board of Commissioners to get done what you want to get done for your constituents. So we bring that to you and we say, we think you ought to expand this because this works really well. And we give you that. That's what you see outside of the recommended budget, outside the continuation budget. We may bring something to you that says, we think you ought to get rid of this because it's not working. But you make that final decision. If you say we like this, we want to add this, then we take the continuation and we add that in on top of it. If you say I don't like this, I want to take it out, then we take that out and we bring you the final budget for you to adopt at the end. That's the process. Now, we're game to doing it any way you want to do it, but that historically, in every budget I've ever produced since I was been a county manager, is how I've always done it. I'm happy to do it any way the board wants to do it, but absent hearing from the board, we want to go in a different policy direction. It's my obligation to provide for you what it costs next year to provide the services you're currently providing this year, unless you tell me you don't want those services, and I've not heard that yet.
So we're getting started here in February. We're discussing this tonight. We're getting ready to take a vote on Commissioner Richardson's motion to look at 25% of the budget through the the optics of a zero-based budget. So, bearing that in mind, we're going to meet again in March. You're asking if we have anything to discuss, we should bring it before the board early on. So you'll have it going into the preparation of the budget where we meet in workshops in May. Am I right?
We are asking for policy direction on the board.
Starting now?
For the budget.
We could come and we could have a line item, agenda item, excuse me, for March. If any of us have any thing we would like to talk about.
You could. I mean, that is what we were hopefully anticipating to get out of this last budget work planning retreat, so that we would understand where we were going. And that discussion at the end was where we said, unless we hear differently, we're going to give you what you got last year. If the board so chooses at the next meeting to say these are different things we want to do, we're happy to do that. We just need it in enough time to be able to put it into the recommended budget.
Okay.
Mr. Brown?
If I understand you correctly, in services, as it stands right now and the economy grows, our services are going to continue to be higher. Is that correct?
I would say that, I mean, if I think I understand what you're saying, the question, we have a level of service, there is a level of service that the Board of Commissioners has chosen to provide in the county. That level of service, as inflation grows and as costs go up, to continue to maintain that level of service, in some aspects it may go up, in some aspects it may stay flat. I mean, just think about in your average, on your day-to-day life. Does gas go up? Well, it goes up for us as well, you know. So there is a factor of the budget growing simply because of inflation and costs. If you believe that next year it will cost you more money to do exactly in your personal life, it's going to cost you more in gas, cost you more in this and that, then don't expect that it's not going to cost the county the exact same thing. Because we are under those same constraints, unless you tell us, you know, you may on a personal level say, I'm not going to the movie anymore, so that's where I'm going to save my money. Well, you need to tell us as a staff, I want to do away with this program. Otherwise, we're at the same mercy of the economy that you are on a personal level.
Right.
Yes, sir.
Okay, I think we're ready to vote. All those in favor of Hood's motion of zero-based budgets, and please raise your hand.
For 25% of the budget.
25% of the budget, as stated. All those opposed?
You want to go more? Is that it?
Okay, Mr. Chairman, I have
No, I think your observation is wrong. If you look back at the way it's been done since Brian and Nita was here, through the budget workshops, you can ask questions of the department heads or any of the outside agencies when they come in. Mm-hmm. So you still have, you've got a chance to control the budget all the way down to the very end.
Oh, well, I know that, but
all the way down to the very end.
But what I'm understanding, Commissioner, is that when we start off with this, and the way this has started, as of the retreat, and Brian asked that we give him direction beginning then. Tonight would be a night we could give some direction. I think we just gave some direction. And then coming up in March, we can give direction. But I think he wants some wholesale direction as to what to do. So if you say, I see that this program may be too costly for Beaufort County to afford, and one of us were to bring that in March, or even tonight if somebody has something to bring it up, since we've got it on the floor right now, if it's still on the floor. Chairman, it's not on the floor anymore? Okay, well, next meeting.
We're voting.
But the way I see it is, we bring it up, the commissioner would need to defend cutting that program or limiting that program or seeking efficiencies in that program. And I think we need to not only consider this at the budget workshops beginning in March through May. We need to be making suggestions, and I think we need to do it sooner rather than later after hearing the manager's argument.
Mr. Chairman, yes. I need to ask a question about the numbers that Anita gave us. Go all the way to the bottom right-hand corner of the page, which is the 2018-19 budget, revised budget, the $59,213,277. Is the money that we borrowed included in that number?
actually, that is included in the 17-18 budget. I think Commissioner Waters pointed that out at
Yeah.
the budget retreat, and you and I both were thinking it was actually the year before. It was the current year.
Yeah.
But it was last year.
Okay. Then I want to make a motion to set some policy. And I want to take that number and direct the manager to bring us back a budget that is 5% less than that number.
Second. That's a viable number.
That's setting policy.
Yeah. That's actually, I mean, it's not zero-based budgeting, it's baseline budgeting. You're saying 5% decrease the cost of governing Beaufort County by 5% and figure out where to cut. That's what
And I'm satisfied that there's that much waste, if not more.
That item's not on the agenda. It could have been there.
What do you mean? Huh? What do you mean it's not on the agenda? We're discussing the budget. We agreed at that meeting that we would discuss policy tonight on the budget. And Anita would bring me these numbers, and if you recall, I said to Anita, when I see the numbers, then I will know how to use them.
What is your motion?
My motion is that we reduce the $59,723,000. That's for the whole year, right, Anita?
As it stands as of today.
Best numbers we have. That we reduce that number by 5% in the budget that the manager brings to us.
No, second.
Second. Yes,
Is there a
Mr.
second yet?
Yeah, Stan second.
So we got discussion. I think that if you want 5% out of the budget, then we can do that at the retreat. I mean, at the budget meetings. There's probably 5% waste in the budget. I don't have any idea there's not. But we can do that when we all sit down together, and if we see something that we don't like, we can adjust it at that time.
That never happens because every budget.
It don't matter. It could happen this time.
Well, I want a policy. The manager talked about wanting a policy.
Mr. Chairman.
And we're giving him policy when we do this.
My moment to speak. 5% is exactly of the budget numbers that Anita gave us, roughly, give or take a few $100, $2.986 million. That's what we're looking at. I just heard the manager say, if you're going to give me any direction, start giving it to me now. I mean, he said it's clear as day. And then I joined into talking about doing it next month, since I'm not prepared this month to make any succinct declinations as to what we should cut. So I would like to, I've seconded this. I think we need to consider giving this direction to the manager now in the amount of $2.986 million. I mean, if that's not a good number, come up with another number. But if right now, as it stands, you're saying, Mr. Manager, give us your budget, then we'll approve it. I think we should give him direction. That's our job. And I know I've done this 18 times. I've never done a budget with this board. I've done a budget with some of the members of this board. But
Well, you know how I feel. Don't you?
I know how you feel. I know. God bless you. You're consistent.
That's all right.
And I'm consistent. But I know that what happens is we talk a good game, and we keep talking a good game until it comes time to vote for the budget, and then we capitulate, and then we say, okay, we'll do whatever you say. You know more than we do, Mr. Manager. So what's going to happen is the people of Beaufort County are going to get another tax increase. I think if we're not going to do zero-based budgeting, let's give some direction and let the manager find it. Otherwise,
that's
we
what
can
he's
do a
asking
zero-based budget, and we'll help him find
That's
it.
in context with what everybody said here tonight.
It's been called a question.
I did.
Time to vote.
Yes, sir.
All right. All those in favor? All those opposed?
Looks like you guys are not going to get a tax decrease this year.
Well,
Okay.
Mr. Chair,
Yes.
according to my colleague's numbers here, almost $3 million, and as I promised them at our retreat, if they can tell me where they can cut $3 million, I will support it. But they can't tell me. I'm not voting in the blind.
We're going to tell you when we get into examining the budget. That's what you guys said. Bring it up then, right?
Well,
you're going to get it. You're going to get the decreases.
All right.
You voted against them every year that I have presented them. You have a 100% record of voting for tax increases.
You are so correct, Mr. Richardson. I did. and you have a 100% record of not voting for a budget.
That's right, because they're all bloated and there's waste in them that you would not believe.
I have a question. Are we going to meet March 4th? March 4th is our next meeting?
No, that's when they pass out the documents.
Next March 4th is our next meeting?
What can we do? Say?
No, it's the second Monday.
It's the second Monday.
Second Monday?
Second
See, and
Very good. I'll have something on the 11th.
Mr. Chairman,
Yes.
I'm going to show you something. I'm going to show you a little bit.
just for a little bit of
Come up with
clarity,
Hang on, Stan.
just for a little bit of clarity, $2.9 million equates to the entire funding for the community college.
Good Jesus Christ.
It equates to the entire.
Wait a minute, Mr. Manager, you're playing politics
No, no,
right
I'm
now.
just- no,
Oh,
I'm
yes,
just
you
saying.
are. When you're sitting there implying that we're going to knock out the community college because Stan and I have asked for a reduction,
No,
you
sir.
don't need to get involved in our deliberations up here and start playing politics because that's what you're doing.
No, sir,
You need to run for
Mr.
office if
Manager,
you want to do that.
Mr. Manager,
Let me.
$3 million will cut out a whole lot of stuff.
I'm
A
trying to
little
put
bit
it.
here, a little bit there. We'll make it work.
I'm simply
Just
trying to
figure it
put
out.
in perspective what we're talking about.
Then use
What we
5%
need-
on everybody's budget. Don't say we're knocking out the community college because that's not what we're doing. Oh, yeah, I'm irritated about this. This is politics. The manager has stepped out of his realm into politics.
We're moving on to items for decision. Jamie?
Okay. Under item number 1, under items for decision, first thing we have is the petition to name a private road, Nirvana Circle in the Bath Township. You should have an agenda abstract in your packet for that item. The summary, a completed petition to name a private road was submitted by Mr. Ronnie Beck to name a new unpaved private road of approximately 450 feet in length, which connects to Mordecai Lane in the Bath Township. The road would serve a 3-space minor travel trailer park, which meets the requirements of the Manufactured Housing and Travel Trailer Park Ordinance. The road, as shown on the proposed site plan, is 25 feet in width, which meets the minimum requirement of 20 feet in width outlined in the ordinance. The applicant will gravel the road. It has not been constructed as of yet. An advertisement was run in the Washington Daily News for 2 consecutive weeks, and notices of the hearing were posted as required. The Beaufort County E911 ordinance requires applicants to supply 3 proposed road names. Those submitted with the petition are listed in order of preference: 1, Nirvana Circle; 2, Happy Place Circle; 3, Marsh Circle. Staff has determined that the applicant's first proposed name, Nirvana Circle, does not duplicate any existing road names within Beaufort County, nor do any sound-alikes exist. You can see the attached property map and site plan showing the subject road, and staff recommendation is to approve the applicant's proposed first choice of Nirvana Circle.
Motion to approve.
Mr. Chairman, let me comment on this. This should never have been brought to us to begin with. Staff may be recommended it, but it's totally out of order for staff to do this. This is 3 camper places, 3 campers that are being put on about a 2-acre lot or down that comes off of a main road. This is, and naming this, it's a U-shaped driveway. Camper trailers are not residences. Our ordinance, and she tells me structures. I don't care. It's a structure is firmly attached to the ground and affixed to the ground as real estate or as a mobile home. If we do this, we are creating more problems. I've complained in here bitterly that every pig path in Beaufort County has a name on it. This is 3 units that's going to be used for vacation for a family. Let them put a mailbox up on the street like everybody else does, so that the mail carrier is not going down this, so that the sheriff and emergency services can find this. Camper trailers are not residences. They have to be moved every 6 months under our ordinance. So I'm asking you not to do this because you're creating a problem. It's totally unneeded.
I have printed out 2 pages from the addressing ordinance that speak to this situation. I can pass it out. I thought it might be helpful for us all to look at it together.
Thank you.
Now, while she's doing that, if I may, Mr. Chairman.
Yes, go ahead.
The addressing committee worked on this before this was turned over to Mideast for administration here. And our whole purpose in doing this is to stop these phony addresses from being given out that are confusing to the sheriff and the EMS. Because Mordecai Road or Lane or whatever it's called is only about 3/10 of a mile long. So you're going on a road that's about 3/10 of a mile long, and now you're putting another street name on it for people to keep up with for what in a travel camper park is not a residence. It's a camper. It's used temporarily. So again, I'm asking you not to approve this. I've had a conversation with this lady. Well, the ordinance needs to be changed. This is their interpretation of what a structure is. A structure can be 3 pieces of wood nailed together. I'm an engineer. That's a structure. Okay, so what kind of thing are we talking about doing here? We need to stop what we've been doing and making things worse for EMS and the sheriff and making things more reasonable for the rest of us. This is not even a legitimate subdivision of land. It's a 2-acre lot that fronts on a road. So I'm hoping that you won't vote for this. At least table it if you must until next month so we can figure out what we want to do, because this is not good policy.
Mr. Chairman.
May I ask a question?
Yes.
The part that you are showing us is the highlighted part here. Is that what
Yes,
you
sir.
want, Jamie? And as it states right now, if we was to do this, we are within our policies, aren't we?
Yes.
And if we go back and amend these policies, it's not retroactive, is it?
I think it would be helpful if we go through the ordinance, if you don't mind, but no, if you change the ordinance, that only changes it from that date moving forward. It's not retroactive.
That's
to answer your
thank
question. Yes, sir.
Then we should table this until we can get our ordinance straightened out, because what's going on here is the planner's interpreting a structure to be anything that anybody sticks out there. A rabbit box, 3 pieces of wood nailed together, a camper trailer, a brick home, all of that they're interpreting as being something that's worthy of having a street address. And we're just making trouble for ourselves, for EMS and for the Sheriff's Department. A mailbox up on the road for it's a temporary residence, lot 105 Mordecai Road, Lot A, Lot B, and Lot C. That does it. It's only 200 feet off the road. It's a private lane. It's not a dedicated right-of-way. And we've had serious conversations within the group that's working on this about it needs to be a dedicated right-of-way before it's named. This is not a dedicated right-of-way. It's so far from where it should be that it's unreal. So if you have a tendency to want to approve it tonight, I guess a motion to table is in order.
Second.
And let's come back and look at this thing again, because we need to toggle her absolute interpretation of what this ordinance is, so that these things are not, so that campers don't become permanent residences. And that's going to become another problem in Beaufort County.
Mr. Chairman,
Yes, sir.
if you look at page 2 of the handout, it says, number 1, a private road should be defined as any road, lane, drive, or easement which serves 2 or more structures, not facing any public maintained road or highway.
And if I may say, the planning department is glad to enforce this ordinance any way the board interprets it and sees that it needs to be enforced. This is our interpretation of it, and it's how it has been interpreted even prior to Mideast taking over. But I think it would be helpful if we can at least read through the parts of the addressing ordinance together that apply to this, and then maybe that will help you to make your decision on that.
Well, let me say this before you read, Mr. Chairman. There are several camper parks in Beaufort County using the interpretation that they want to use on this that are complete and total disasters insofar as addressing. We have people living there year-round. There's all kinds of things going on. So using the word structure is the key word in all of this. What is a structure? 3 pieces of wood nailed together is a structure.
Okay, there's a motion on the floor, and it's a second.
Yeah, a slight bit of discussion here.
Dan,
Yeah. Yes.
hold it down if you can.
Yeah, keep it short.
We're ready to vote.
Yeah, no, but we always have discussion period.
Go ahead.
Okay. What, the way I see it, years ago, when we enacted the subdivision ordinance, I remember Commissioner Richardson, you were on the board, I was on the board. We didn't want the subdivision ordinance, but we both used our talents to help craft as good a subdivision ordinance as was possible at that time. One of the things I see bleeding in here, and I may be wrong, you could probably correct me, but when you take one piece of property with one septic system and you say, we're going to put another structure on this septic system, I think you've got a problem unless you get the environmental health to approve the extra bedrooms. Then you've still got another problem in that you're going to have to separate the utilities. You're going to have a separate water meter, and you're going to have separate boxes for your electricity. Now, I guess that's the purpose for taking one piece of property and putting two structures, two residences, so that this complies. Because when I read this, this page over here, private road shall be defined as any road, lane, drive, or easement, which are two or more structures. To me, to serve two structures, those structures have got to be viable for some purpose, right? I mean, we're not talking about a chicken coop. We're talking about a place where people live. Am I not right?
To answer your question about the septic, they have to get an improvement permit from environmental health before they're approved through planning, and that was taken care of. And sorry, what was your follow-up?
Well, that would be taken care of first. Now, my follow-up to what we've just discussed is now you're talking about you're tacitly making changes so that it could be construed that there could be a subdivision of the one lot serving two separate purposes.
There's no subdivision occurring here. They applied through the mobile home and travel trailer park ordinance, which would allow with the site plan for multiple on one lot through that mobile home and travel trailer park ordinance. So there was no subdivision in this case. It's an existing lot that they're wanting to set up a minor travel trailer park on, and their site plans are in compliance with the travel trailer park ordinance.
But this is more of a broad declaration here discussing that it's for any two or more structures. It doesn't mention trailer park or...
This is not from the travel trailer park ordinance. This is from the addressing ordinance.
Addressing ordinance.
Yes, sir.
Gives you part power to do part of this. Am I not right?
The addressing ordinance covers addressing, whether it's a mobile home park or a travel trailer park or a single-family house. That's covered under the addressing ordinance, and their standards for development for their site plan for the travel trailer park is covered under the travel trailer park ordinance. That's just pretty standard how those things work.
Seems like we're getting down into the weeds, and we're really not getting into the whole ordinance. And
thank you, Stan.
I do have a copy of the entire addressing ordinance if anybody wants it. I thought it would be good to print out the parts that were actually applicable to this situation, and I would still like to...
The subdivision ordinance prevails, not the addressing ordinance. You don't got the wrong ordinance.
Commissioner?
Yeah, I'd like to rescind my motion, and I would like to table this to next month so we can talk to EMS and Chief Deputy Rose to see whether there would be any confusion because of it.
What motion did he make? What motion did he make? Did you make the original motion?
They made the motion at the same time.
okay, very good.
I will caution the board that if you...
Green said I move at the same time.
Okay.
Well, I'm not rescinding.
I will caution the board that if you choose to table it, that's up to you, but you will hold them up on getting their building permits. They can't get that until this is taken
Do
care
we
of.
have a second?
Whoa. Okay. What's the motion again?
Vice Chairman Lundy motion.
I had the original
to name
motion.
the road
Okay.
as Nirvana.
Second.
Did you second?
Yeah.
Okay.
Is that not Nirvana in the band or State of Mind?
We need a ruling on how the motion to table fits into this.
It came afterwards.
It came afterwards.
Yes.
Well, ask the attorney. He's our parliamentarian. Within our rules, the motion to table, can it be made at any time?
You got to address your...
I don't know right at this moment.
again, we should table this because this is not a good deal.
Question.
Okay. Did you say question?
Well, if we're going to vote, then I want to know what I'm voting on.
Go voting on?
To approve the name.
Yes.
To make that into a street.
Is that correct?
Yes, that is the item for decision, yes.
Okay, then all those in favor, raise your right hand. All those opposed?
Name the street.
Name the street.
And item number 2 under items for decision was the petition to name a private road, Trejo Road, in the Chocowinity Township. We do need to pull that one until next month. The applicant did not get all the signatures on their petition in time. We wanted to go ahead and have the public hearing, so we did not have to have the expense to re-advertise that, but would like to pull that until next month, and I'm not sure if we need a motion for that or not.
No.
Is that Trejo Road or Danny Trejo Road?
Trejo Road.
Okay, very good.
And item number 3 is text amendment to the subdivision ordinance. You should have an agenda abstract in your packet for that. So to give you a little background, the subdivision ordinance is not clear on how many residential structures or primary residential structures can be on one parcel. Staff has received a wide variety of comments, not just from the planning board, who we worked with this on for a few months, but also from county staff, some surveyors, and some other interested community members. To sum those comments up, there is a wide range of opinion on this issue. Some people feel like it should only be 1 per lot. Some people feel like it should be 2 in certain circumstances with a plan review. Some people feel like it should be 2 without those regulations. I'm providing the board with 2 options to review tonight. The first option would allow 2 residences per lot in certain circumstances with a plan review to go to the planning department to approve those. This is the option that was unanimously recommended by the planning board. The second option would only allow 1 primary residence per lot, and that is much more common when looking at the subdivision regulations of other counties in the state, which is why I did want to provide that other option to you. So again, the recommendation from the planning board, they unanimously recommended approval of the proposed text amendment, which allows 2 residences per lot in certain circumstances. And I'm going to review both of those with you, and I will say from the planning department perspective, we feel comfortable enforcing either of these. Really just need some guidance and direction from the board, since the ordinance is really not clear on this topic.
I think I was conflating these 2 issues. I'm sorry.
Oh, that's okay. Okay.
I'm ready for this one.
Okay.
I make a motion that the board approve option 2.
Second.
Question? Discussion?
The comment I would have is that option 2 allows the lender to have a more perfected lien. When you start having 2 different dwellings on the same piece of property and it's not the same person, when they get ready to get financing and get all the permits, it's a real disaster, and sometimes it keeps them from being able to do that. So option 2, I think, clarifies that and helps with the financing.
Discussion? And vote. All those in favor? All opposed?
Yeah.
Thank you.
Thank you. Sorry.
You good?
I'm going to take a short break.
Yeah, Robert Rodriguez brought him out of jail to trade boxers. That's how he got him in the movie business.
Okay, we're back. And Mr. Mercer?
Commissioners, thank you for allowing me to present tonight. In the January meeting of the EMS Oversight Committee, we received an application from Royal Protection Services, LLC, wishing to start their initial franchise for non-emergent transport service here in Beaufort County, and this is for your first reading. If you have any questions, I have Mr. Andrew Cacaro, one of the co-owners of the company, with us tonight.
He's back.
What you need, a motion?
So moved.
First reading.
Second reading?
Second.
Do you need a motion?
Just got,
Just to go to the second reading, that's all.
All right.
No motion.
No motion.
I'll take mine back.
you got it.
Thank you very much.
Thank you. Thank you for coming.
Yes, sir. Thank you.
Lisa?
You've got in your packet the agenda abstract. The Holland put out an RFP. We needed some legal services and appraisal services for one of the projects that you approved 2 years ago, I think. And they put the RFP out. They got responses from 3 law firms. And as you have that information, the low bid was Misa Rayner in Belhaven. They got no response on appraisal services, so they have put that RFP back out. So the recommendation is a motion to retain Misa Rayner for that legal service.
Mr. Chairman, I move that Misa Rayner be the attorney.
So moved. Second.
Okay. Any discussion? All those in favor, raise your right hand. All those opposed?
Cheap as beer.
Thank you.
Thank you.
It was cheap as beer.
Don't get too close, that's all I'm going to say. That bug you had the other day.
All right.
Got any more hand sanitizer?
Yeah.
I do have some more if you need.
No.
I didn't bring it with me.
Have you got
As long as you've got it. As long as you've got it. That's
Do
all.
you have that simple container?
Yeah. Okay, well, this goes back to, we were asked earlier on after Hurricane Florence if we needed any help to support the mosquito abatement programs that we have in place. They asked us to send them an itemized wish list. I sent them a list, and we asked for $44,000, and in that wish list, I asked for a truck. And so they said, okay, and they gave me $64,000. So, this is what I'm asking for, your approval to go ahead and purchase the truck. I can't remember the exact number, but around $30,000 for the truck. It's four-wheel drive, so we'll be able to get back a little bit further than where we normally go for those mosquito surveillance traps and stuff that we're doing.
Mr. Chairman.
Put a fogger on that truck.
A what?
Put a fogger on that truck.
What we'll probably do is move the older one down to becoming a fogger truck.
Oh, okay.
Commissioner Rand?
Is there any way that it put you to disadvantage if you could hold off on this until budget time?
I have to spend it before then.
It's
grant.
Oh, there's no county dollars.
Oh, that's right.
No county dollars.
Motion to buy the truck.
Got a motion?
Second.
Second. Any questions? Any discussion? All those in favor, raise your right hand.
And now I got a question. What you can do with the rest of the money?
One of the things we're going to buy is...
Now, what I want to know, I mean, you got to spend it before budget time.
Well, right now, the traps, we set them out at nighttime, and then the next day we pick them up, and we know there's like 4,000 mosquitoes in there. So we're getting an attachment that goes on top of it that'll count what time they go through.
Okay.
So that'll better tell us what time we need to spray. 'Cause if you're coming through between 6 and
you got
7, we know that's the best time to spray.
So you got another 20,000.
Yeah, the rest of it, we're looking at GPS. We're looking at 2 new foggers.
All right. I just want to know, you had to ask y'all them questions now.
Jim, since you're standing up here, just to tell the public, come mosquito season, which is going to be here sooner than later, just to reiterate what we talked about the other day in the retreat. But you said that you're going to be trapping, you're going to be trying to figure out where the mosquitoes are at their worst. But you also said if anybody has a problem,
Have they ever complaint driven,
if they can prove that at least 15 lights per minute, landings lights per minute, then that would be a serious contender for a fogging.
Right, so you call us and we'll go out there and investigate it and determine whether we should be spraying it or not.
Excellent.
That's called consumer-driven complaint.
So consumer-driven complaint, people need to be ready and prepared to complain, and we'll fog this county next year.
Well, but we still have some time constraints, but yes, we'll do that if we can.
Okay.
To take care of those complaints.
We kill them in my neighborhood, we got to kill them in every neighborhood.
Thank you, John. Christina?
This is Beaufort County, though.
I know, let's kill them all. A good mosquito's a dead mosquito.
Good evening, Commissioners. As you'll see in your agenda books, I come before you tonight with information regarding the Community Waste Reduction Recycling Grant Program. This is a program that's run by one of the divisions of the Department of Environmental Quality through the state. Currently requesting that you allow us to submit the attached grant application. This was prepared by CDM Smith. It is referencing the remodel, expansion, whichever term you'd like to use, of the Ransomville convenience site. As you recall, due to the closure of another site, this site, we have been given the direction to expand the site and to make this a mounded site instead of having to utilize steps to access the containers. So again, this grant fund would just go to supplement the funds that would be needed for the expansion of this site. You will see that it is a match is required. It's at least a 20% match, but again, keep in mind that this is a project that we were looking to fund anyway, so if we were to receive grant funding, it would just decrease the expenditure that the county would put out.
Motion that we approve to allow her to go forward on this grant.
Second.
Second. Discussion?
Yes, I got it.
Okay.
I'm going to vote for this, but is there going to be any oversight on how this project is going to be handled? Because I know that people are recycling and it goes in the same trash truck. I've seen it happen.
This goes back to also, we've heard this a lot tonight, a discussion that was had at the budget workshop, and I will, budget retreat, and I will say the same thing that I said before. Beaufort County is contracted with a company to transport the recyclable containers to a recycling facility. And that is what is supposed to be done. And again, this project is to improve the amount of recycling that can be done so that it allows people to be able to drive up a mounded site and with ease dispose of their recyclables in the appropriate container.
Any other questions? All right, all those in favor, raise your right hand. All those opposed?
Thank you.
Thank you. Mr. Richardson.
Oh, which item is it?
Health insurance bids.
Oh, yeah. At the last commissioners meeting, well, let me give about 2 minutes of background. Dale Falwell, the state treasurer, has a terrible fight going on trying to bring efficiency and reduce cost in the state medical plan. Beaufort County, all 390 of our employees are in the state medical plan, so if Falwell manages to reduce cost, we reduce cost. It saves us money. The commissioners, to my chagrin at the last meeting, decided that they were not going to support a resolution to support Dale Falwell, the state treasurer. And I might tell you that there are other organizations that have already done resolutions supporting Dale Falwell. So if the commissioners don't want to see the cost of health care that we're paying for our employees reduced, I think it's time for us to go out and see what the market proposes insofar as competition for the state medical plan. And that's my motion. My motion is that as a part of our budget process that we bring in 3 bids from companies, entities, whatever you want to call them now, to provide us with the equivalent care policy to what we have now.
I second that, just to see where it goes.
Brian, do you have any comment on that?
Yes, sir. We actually had our, this is going to sound weird, we had our HR department reach out to the state health plan, talk to Mr. Howard Michael, who's a manager with the state health plan, and he referenced them to General Assembly Session 2015, General Statute 135-4847, which says a local government who's participating in the state health plan cannot revoke its participation in the plan. Specifically, it reads, local governments participating in the plan as of April 1, 2016 may elect to withdraw from the participating in the plan effective January 1 of 2017. Notice of withdrawal must be given by the local government to the plan no later than September 15th of 2016. Now, I mean, what I take from that, what he says is, you're in it, you can't get out of it. What I do know, and maybe that's just an argument, I don't know, but that's what he says, and I would let the county attorney take a stab at that. I do know that the plan is capped for local governments at 16,000 members, and it is at that cap. So if you were to get out, if you could get out, you would never be able to get back in. And just for some information, for the last 6 years, there has been an average increase in the state health plan of 2.6%.
That's good.
2.6, Brian?
On average per year, 2.6%. They also implemented in 2018 where employees start to pay $25 a month on the 70/30 plan, $85 if you're a smoker. So they've differentiated out and said if you're a non-smoker, you pay a cheaper rate. If you're a smoker and you choose not to stop smoking, then you pay a higher rate. That was one of the Treasurer's initiatives. And then for the 80/20 plan, they pay $50 a month, or $110 if you're a smoker. The other information I pulled from Kiplinger said that for the 6 straight years, there's been a 5% increase in employer health coverage in the overall market. So we will. I just bring that information to you for your consideration. I don't know what
let me do this. Say this. Number one, the state medical plan is in the hole. So whatever the percentage increases that we are doing is a whole lot less than what we're paying. There's a very good chance that if the state treasurer has his way, that he's going to want to make this thing whole. And my understanding, the last number that I heard was $40 billion in the hole. So when that happens, we're going to have to dig in our pocket to make that up. And so I'm willing to withdraw my motion and make a new motion. Okay. Is my second willing to withdraw?
Second. Yeah.
I move that we ask our House and Senate representatives to introduce a local bill so that Beaufort County can, at our option, we don't have to, at our option, can withdraw from the state medical plan. Then we can go out, and then after that, I'm going to go back and after you pass this, I'm going to make my other motion. Because you're in a trap. It's going to cost you a lot of money before it's over with.
Well, it's kind of.
Do we have a second to you?
Yeah. I'll second it. Okay. But let me just say this. The health insurance problem we have right now is one that needs to be corrected. And you've got a treasurer in North Carolina that's doing everything he can within his power to understand what the problem is. And then hopefully it can be corrected from there. I think we need to work within the good offices of the treasurer to figure out so he can figure out how to best remedy the situation. The problem is health insurance after Obamacare has gone through the roof. It would probably cost the plan we got right now somewhere between $15,000 and $20,000 a year per person or per family, and I don't think that's tenable. I really don't. So I mean, I would be more than glad to seek all options, but I don't want to move in a haphazard manner into any direction where our employees would be jeopardized.
Well,
you said something made sense.
It's not a haphazard manner if we ask our representatives to introduce the local bill at our option.
See, I get what Hood's saying. This is just an option thing where we've got that in our hip pocket.
But we're going to spend a lot of money if we're not careful.
Yeah, well, we need to have options, and really, it would probably be wise that every local government have that same option. and know what the market will bear.
Commissioner Brown?
I'm going to ask Brian a question, but in my opinion, I've seen group insurance that is a lot less than what private insurance is. My question to you is, what we're paying now, could the private firm match that?
I can't answer that question. What I will say to you is that I have worked in local governments that have been, this is actually, well, when I worked for the state of North Carolina, I was under the state health plan. Every other entity I've been with before coming to Beaufort County had their own insurance plan. City of Washington has their own insurance plan. County of Granville had their own insurance plan.
Smart guy.
In that, you're dealing with a pool, and that pool is made up of your employees and your employees only. According to the state health plan, they have over 720,000 members in their pool. If Beaufort County were to go on its own, you would have 387 members in your pool. Pooling helps when you do that.
So the chances are that the insurance would go up.
I will tell you that in the private, in individual policies that I've dealt with in other agencies I've been with, it was routine to see 7, 8, 10, 12% increases each year. Health insurance is going out the roof, and the way to protect yourself on that, I think, is to pool with others and minimize those risks. And I think the state health plan does that. It's obviously a policy decision by the board to proceed however you wish to proceed with that.
Well, let me say this. You say 7, 8, 10%. Okay, sorry.
I haven't finished. My wife was in the insurance business for 23 years, and I questioned her about that when I read this. And she said definitely that a pool was the way to go. So that's my opinion.
Yeah, and I don't disagree with what y'all have said. I mean, you're right on target. That's exactly how it works. But the unknown in this is the deficiency that's in the state health plan, which is a significant deficiency. All that my motions do is put us in a position of flexibility so that we can jump either way. And there's nothing wrong with that. That's a good business position to be in, to have the option.
So you're saying we can either stay or go?
Yeah, I'm just asking for the option. When the special legislation is done, we want the option, which we can stay or go. And, you never know. There may be some insurance companies that are willing to come out in order to compete with the state health plan and give us a better deal, just to break the ice with that. So you don't know what's going to happen in the business world, but options are important, and I think we need that option.
I don't have a problem with ordinance, well, not an ordinance, but a resolution stating that we have
the
option to leave or stay. So I'm going to support that.
Yeah, I think what will happen is, if this is successful in getting a local bill passed, you'll see other local commissioners groups looking to do the same, just to have the option.
I don't believe that.
I think you will see some. But the thing is, the pool probably is right now the best, unless it's been mismanaged. And if it's been mismanaged in a terrible way, it could have an anchoring effect to drag us all down. So I think the best option is to have an option as per Hood, but also to support our treasurer to find out where the deficiencies are and do everything within his power to correct them.
Okay, we ready to vote?
Just let me do one second and I'll be done.
Sure.
Yeah. Once the legislature finds out how big of a hole the state health plan is in, they are not going to give you the option to get out. If you're going to get an option to get out, you need to get out right now, or you need the option before the storm comes. Because when the storm comes, they're going to keep you in there, because it's going to reduce everybody's cost making up these arrearages.
How can they stop you from getting out?
Right now, he just read the law. That's why we need the special bill.
Yeah, I think what the manager was talking about, we can't get out mid-year. I mean, we can get out at the first of the year. Am I right? Can't get out at all?
Well, I mean, I'm not an attorney, and I don't interpret how that is, but the way I read that is it says you had an option to get out, and there was a time period.
Yeah.
And if you didn't get out, you're in.
Yeah, you're in, at least for the rest of the year, right?
No.
At all?
No.
Good? For all? Good.
That's why we need the special.
Okay,
deal.
thanks.
I missed that when you read it.
It was the 20.
It was the option.
It was the 2015 session of the General Assembly.
Just done.
All in favor?
It said local governments participating in the plan as of April 1 of 16 may elect to withdraw from participating in the plan effective January 1 of 17. Notice of withdrawal must be provided to the plan no later than September 15 of 16.
Yeah, you're in. But the special legislation can take care of us.
Why would they pass a special bill allowing us to get out if they're in the hole? Because they need participants.
They don't know they're in
The
hole.
bill forces you to stay in, Frankie.
Hood said don't know they're
They
in the
won't
hole.
let you out.
Well, he's quoting $40 billion. Where did he get his information from?
I got it from the 3rd District Republican Convention meeting last Saturday, which did a resolution supporting Dale Falwell to reduce the cost.
Call the question.
That's where I got it from.
Well,
why weren't you there?
I've been involved where you end a group and you decide to get out. And what happens is you get 3 people that'll come in and they'll bid on it, and then 3 years later, nobody wants you. So then you can't go back to the group. That's the risk to the employees here in the county.
Yeah, but we're just talking about options right now.
Okay.
That's all we're talking about, is getting ourselves in a flexible position to save ourselves some money.
All right, we're ready to vote. All those in favor of Hood's option of getting out?
No, go into.
I'm sorry.
The option to get out, should we need to.
get out.
Yeah.
Special local bill.
Special local
A
bill.
local bill for an option to get out if we want to.
All those to join Hoods. Let's do it. All those opposed? Okay, Hood. Sheriff Department.
Okay, we're back to the Sheriff's Department. You know, Commissioner Richardson would like a motion to reduce the Sheriff's Office budget during the year 2019-20 fiscal year. He would also like the manager to present comparable costs from other counties during the budget presentation. Now, I know what the manager is going to say, and that is, the board voted that they didn't want that information, not to do the 10-county study of comparables. But I don't think that keeps him from showing us what a comparable county or two would is what the Sheriff's Department is costing. So I make that as a motion.
Would you restate that, Hood, motion?
The motion is for the manager to present some comparable cost for operating sheriff's departments in some comparable counties when he does the budget.
All right. In other words, to seek efficiencies.
Well, so we can see what it is costing.
Yeah.
See what other people.
To seek comparable efficiencies.
Yes. Comparable.
Is there a second?
I'll second it. Nobody else will. Wait, hold on. Ed, would you like to second it?
No, I'm not going to second it.
Okay.
She'll go ahead and second.
I didn't want to jump in and steal the fire.
You go ahead, grandstand. Did you second it?
I did, but I thought maybe you would.
And I'm going to tell you something else that's going to shock you. I'm not going to vote for this motion because you can't.
You're kidding me.
Wait a minute. Let me tell you my reason why. You can't compare our sheriff's department with one our size, because name another sheriff's department that's got a raggedy jail like we got. Name
about half of them in the state, Ed.
That's right. And name another sheriff's department that's sending 50% of their inmates to other entities. Name another department that's doing that. So if you can get those numbers together, then I would consider voting for that.
It's all in the parsing of the numbers, Ed.
All righty, I got you. That's all I got to say, Mr. Chairman.
Okay. The only thing I would recommend to everybody, just keep in mind our sheriff's department is pretty unique in the fact of naming how many counties out of 100 is divided by a river. So fortunately, we've got Sheriff Department North, Sheriff Department South, we got a detention center, then we've got a courthouse on the north side. So to go out and find some comparable, I don't know how in this sound, heck, you can do that.
You're not going to be able to do it.
That's what I'm saying.
Gee, another impossible task. This board comes with more things that are impossible.
I know it's easy.
Gee, it's amazing. We're so unique.
Oh, ready to vote? The Hoods?
Nobody else.
I think thinking out of the box is becoming a calamity for you, Hood.
Yeah, I think so. Yeah. Must be something in the water here.
All those in favor, raise your right hand. All those opposed? Brian, Antigua.
Thank you, Mr. Chair, members of the board. As you'll recall, if you look in your agenda item, at a regular meeting on June the 12th of 17, the Board of Commissioners held a public hearing and received comments on including the territory within the corporate limits of the town of Pantigua in the Pantigua Rescue District. You have that agenda item attached. There were no comments that were received from the public, and the board voted unanimously to include the town of Pantigua. The town of Pantigua actually passed a resolution asking to be included. When tax bills for 17-18 and fiscal year 18-19 were generated, the rescue service tax was not included on those bills for properties within the corporate limits of the town of Pantigua, so it was missed. The general statutes authorize the county to bill for those uncollected taxes and allows the Board of Commissioners to reset the interest rates, the interest deadlines due to that error. It is our recommendation that you apply the rescue service taxes for 17-18, 18-19, and that be sent to the parcels within the corporate limit, and that those bills be accepted for payment without interest until June 30th. On July 1 of 19, they would begin drawing interest. That's roughly the same amount of time they would normally get if the bills had gone out in July or August. You have a letter that we've attached that explains that would go out with the bill. So we would make a recommendation that you
So moved.
Second.
Question? Ready to vote? All those in favor, raise your right hand. All those opposed? Mr. Alligan. The phone system.
Actually, I think Mr. Leggett is going to present that from DSS. I apologize.
I'll get it next meeting. I've got something you'll like.
Hey, Derek.
Hey. Good evening, Commissioners. We come to you tonight as a result of our discussion at our annual budget retreat regarding our aging phone system. The current phone system at DSS has failed on multiple occasions, most notably during the first day of Disaster Food Stamp Administration and during LEAP, which is Low Income Energy Assistance Program, both of which are extremely busy times for DSS. As you are aware, it is critical that we have a phone system that we can depend on. We've received multiple Child Protective Services reports for adults and children daily, as well as inquiries regarding Medicaid and food and nutrition benefits. It is imperative that the citizens of Beaufort County have access to our employees by phone. Since 2013, we have spent over $11,000 in repairs to our current system, and our vendors have repeatedly expressed that our system is near its end of life. Tonight, we are requesting your approval to purchase a new phone system for our agency and adopt the budget amendment to pay for the new system.
So moved.
Second. Third. Now, is this
discussion?
Yes. Is this phone system going to piggyback with the phone system we discussed at the December meeting? I do believe that I was very clueless of.
It is the same phone system.
It is, and so there'll be a certain cost efficiency spread to them as well.
Yes, and just for the board's perspective, we want to make sure you're clear, this is a sole source purchase under General Statute 143-129E6, with the reasoning being standardization and compatibility as the overriding consideration. The general statutes allow you to do that because you have existing phone systems in the county, not just here, but in other places that are compatible with this. So standardization and compatibility is the reason we bring this to you as a sole source. It's not any other reason.
Let me ask this question. I'd rather not increase this year's budget or take this out of the fund balance. Is there any way that this can be in next year's budget? I think I know the answer, but
not unless you want to wait until July 1 to issue.
No, we don't want to do that.
And 50% of this will come back under reimbursement. Now, it will take us, it'll be stretched out over an indirect cost period of 7 years, but you'll get 50% of this money back from the federal government.
Okay. All those in favor of the phone system upgrade, raise your right hand. All those opposed?
Thank you.
Thank you, Dave. Mr. County Manager.
Thank you, Mr. Chair, members of the board. You have in front of you a contract amendment from Young Williams Young Williams provides the child support services to the county. That was under a multi-year contract. That contract ends June 30th of 2020. There have been recent changes in operations and compliance that require some changes to that contract. The changes include the non-renewal of a contract with the sheriff's office for a deputy that was serving papers for them. Young Williams had a contract directly with the sheriff's office to do that. They've changed and let that contract expire, and instead of having an individual deputy, they're going to use the general service method where they just pay $30 and it goes to the sheriff's office and they serve it. So those costs were being reimbursed under your contract, so it reduces that cost, as well as there's some changes from the IRS regarding federal and local background checks and the use of two-factor authentication for computer access under child support, the databases they have access to. So overall, you'll see the changes to the contract reduce the cost to the county in this fiscal year by $53,600, and then in next fiscal year, which is the last year of the contract, it would reduce the cost to the county by $107,200. So we would recommend your approval on that.
So moved.
Second. Discussion? All those in favor, raise your right hand. All those opposed?
Don't ask me why.
Katie?
Don't ask me why.
You heard at the planning retreat, the Board of Education for Beaufort County is seeking a resolution in support of local control of school calendars. That's what this is about. If you'd like, I can read the resolution. Basically, it's asking for local control of school calendars.
So moved.
Second.
Discussion? All those in favor? All opposed?
Children working in Beaufort now.
Katie, will you read us into closed session, please?
Motion to go into closed session needed under
Schedule.
North Carolina General Statute 143-318-11A3 to consult with an attorney.
I want to bring this stuff up. You go ahead and second my motion and vote the way I do. I can go a lot faster. I'll talk less.
For discussion of existing litigation, Larry versus Board.
Move we go into closed session.
Second.
All those in favor?
Bye, everybody.
Okay, we're back. And do I hear a motion to adjourn?
So moved.
Second. All in favor? Thank you.